Dr. A. Beyer here today. Today we're going to talk about what exactly exercise does for your brain and how important exercise is for your brain. If you know me personally, you know that I'm a big believer in exercise, not because of how the way it makes me feel, but also, well, that's one of the reasons, also because this stuff I'm going to share with you today is loaded in the scientific literature. There are so many studies, for example, that show that exercise by far is better than any antidepressant for depression. And really what depression is your frontal lobes in your brain crashing down on you. So let's talk a little bit about what exercise biochemically or neurochemically does to your brain. When you exercise, and we're going to talk a little bit about how much and how long and all that at the end, you release what's called brain-derived neurotrophic factors, or BDNFs. These are very important chemicals in our brains that allow for better connectivity between all the neurons in our brain. A healthy neuron is a connected neuron. If you have 5 neurons that connect onto one, that's much better than one connecting on one and that one connecting on another. Connectivity is very important, and this is what these BDNFs do, and they greatly increase when we exercise. It also, exercise raises growth hormone, which is not only good for your brain, but having good levels of growth hormone is like putting fat on a hot skillet or butter on a hot skillet. It'll burn the fat off your body quicker than anything. Many of my patients who really gain weight as they get older, it's a result of low thyroid or low growth hormone production, which comes from the brain, the pituitary gland. Opioid release. Okay, we have, all of us in our brain have these opiate receptor sites. This is why people that take heroin or morphine can get addicted almost instantly. But we have natural opioids that are produced in our body when we exercise, and these will bind to these receptor sites and create a euphoric feeling. And many people who tell you, many of you who are watching this know what I'm talking about. When I get done exercising, I feel great. I mean, my clarity of thought and everything. In fact, my wife will kick me out of the house if I don't exercise for a day or two because I get cranky. All right, so that's that exercise high, you get an opioid release. It improves insulin resistance. Insulin resistance is where your cells in your body are not listening to insulin. Well, what insulin does is it pushes glucose into your cell where it can be converted into energy. And remember, if you've seen my prior videos, your neurons are like car engines that get 2 blocks to the gallon. They require a lot of energy. They require a lot of glucose. Glucose in your bloodstream is useless. It's got to get into the neurons or into our cells to be able to be produced into energy, and insulin is what does that. So many people with high blood sugar, they're not able to get the sugar into their cells because their cells aren't listening to insulin. You can overcome a lot of that just with exercise alone. It also improves nitric oxide expression. Exercise helps our nitric oxide expression. Nitric oxide is a chemical that actually was the molecule of the year in 1992 in Scientific Journal. We have different systems in our body that run on nitric oxide. One of them is our neuronal systems. Our nerves need a certain type of nitric oxide for them to work properly. Another one is our blood vessels, our endothelial nitric oxide systems, which need nitric oxide. And then another one's our immune system. Our brain, our cardiovascular system, you'll decrease your risk of cardiovascular system with this, and our immune system all require a good expression of nitric oxide systems. These systems run much better when we exercise. Now, the type of exercise that I'm talking about doing really doesn't require much to get the benefit, at least a minimum of 20 minutes a day. 20 minutes a day where you take the number 180 minus your age. That would be the heart rate that you shoot for. I'm 55 years old, so when I go to the gym and I do my cardiovascular exercise, I go for 30, 40 minutes. I shoot for 125 beats per minute, and I get this effect right here. If you really want to high gear it, you're going to get better opioid and growth hormone release if you do what's called high intensity interval training, where you do short spurts where you really get your heart rate jacked up and then you come back down, you go back and forth. I'm Dr. Beyer. I hope that helps. See you next time.